Thank you for inviting me to discuss worker health and safety from oil rig to shoreline. This issue has been brought to our attention in the most tragic way possible, with the deaths of 11 workers and injuries to 17 others as the result of the explosion on the Deepwater Horizon. Secretary of Labor Hilda Solis's vision for the Department of Labor is good jobs for everyone. Good jobs are safe jobs, and the Occupational Safety and Health Administration is working closely with other federal agencies to prevent additional worker injuries, illnesses, and deaths from the oil spill cleanup. As you are aware, OSHA has no regulatory or enforcement authority over oil drilling rigs or production platforms located on the outer continental shelf where the Deepwater Horizon was located. Section 4B1 of the Occupational Safety and Health Act preempts OSHA from enforcing its regulations if a working condition is regulated by another federal agency. I will therefore focus my remarks on OSHA's efforts to keep workers safe during oil spill cleanup operations. Excuse me. Our involvement in the BP oil spill is part of a coordinated federal response, which includes the Coast Guard, the National Institute for Occupational Safety and Health, the National Institute for Environmental Health Sciences, and other government agencies, as well as BP, to ensure that cleanup workers are protected. OSHA personnel were first deployed to the Gulf during the week of April 26th and are now present at all 17 staging areas. Every day, OSHA has over 146 professionals protecting workers throughout the Gulf region, 25 of whom are assigned solely to the oil response cleanup. We have made more than 1,100 inspections and taken over 500 environmental samples. OSHA is on the beaches and on the boats to make sure BP and its contractors are protecting cleanup workers. Depending upon their assignments, these workers are at risk for injury and illness from heat, falls, drowning, fatigue, sharp objects, as well as bites from insects, snakes, and other native species. Many of these workers also face exposure to crude oil, oil byproducts, dispersants, cleaning products, and other chemicals used in the cleanup. When OSHA finds a safety problem or learns of one from workers, we notify BP and we expect the specific problem and similar concerns elsewhere are promptly addressed across the entire response area. We then follow up to determine if the problem has been corrected. OSHA is also ensuring that BP is providing workers, free of charge, the proper training and proper protective equipment. So far, OSHA has found this process to be effective and has not had to issue citations or propose civil penalties to obtain compliance. That option remains available, however, and we will not hesitate to use it should we determine that it is necessary. One of the most serious health hazards facing those involved in the cleanup effort is heat. Workers are often in the hot sun, in the Gulf's high humidity, wearing chemical-resistant Tyvek coveralls, boots, and gloves for 12-hour shifts. There have already been over 100 incidents of illnesses from heat among workers involved in the cleanup, some very serious. From the outset, OSHA has insisted that BP implement a robust program to protect workers from heat stress and heat stroke. All work sites now have a heat stress plan that includes a matrix setting out specific work rest requirements based on the heat and relative humidity, and if workers are wearing protective clothing and equipment, which can exacerbate the hazard. To determine whether workers are exposed to dangerous levels of toxic chemicals, OSHA, along with NIOSH, is reviewing BP's monitoring data and has brought in a team of industrial hygienists to conduct our own independent air monitoring, both on the shore and on cleanup vessels. OSHA experts are observing and characterizing worker exposures in each job task to determine the appropriate level of protection from air contaminants. We are working closely with NIOSH to investigate reports of work-related illnesses and to establish a health surveillance program for workers involved in the event. We have also distributed to workers close to 50,000 copies of safety fact sheets, pocket cards, and pocket guides. Materials are printed in Spanish and Vietnamese, as well as English, in recognition of the diverse population inhabiting the Gulf Coast region. In order to get a first-hand understanding of our challenges, I first traveled to Louisiana on May 2nd with a team of experienced health professionals. I returned with Secretary Solis earlier this month. OSHA's top priority is to ensure that oil spill response and cleanup operations are done as safely as possible, and we are working hard to accomplish this. Last week, the President assured the nation, we'll fight this spill with everything we've got for as long as it takes. OSHA will be there for that fight, doing all we can to protect the safety and health of those fighters. Thank you very much for the opportunity to testify today. I'm happy to answer your questions.